Good evening, everyone. Thank you for coming to this webinar, especially in the middle of July, in the middle of your holidays. As you've seen, the seminar will be about the treatment of children, and I would like to especially concentrate on the treatment of asthma, because both acupuncture and herbal medicine are so successful for treating asthma in children. And I've sent everyone a handout so that if we miss any of the subjects, you can check the handout. First of all, about this panel that you have, I would suggest that you don't do anything, just leave it as it is. There are various things you can do here. For example, you can hide and expand the panel. I suggest leave it expanded. This one would expand to full screen. I don't advise that. You can raise your hand to attract attention. You are muted, so I will not be able to hear you. So you can ask questions if you have questions by using the questions panel. Other people will not see the question, but I will see, and I will answer when there is a suitable break. So I would basically suggest that you leave everything as it is and use the questions panel to ask questions. This is the famous Dr. Zhang Jingyue of the early Qing dynasty, who said that to treat a child is equivalent to treating 10 men. And by that he meant that it is 10 times more difficult to treat children than it is to treat adults. I must say I don't actually agree with that. I don't think that treating children is actually difficult, because their pathology is relatively simple compared to adults, and also they usually react very well to treatment compared to adults. Of course, the difficulty in children is mostly practical difficulty, how to insert the needles and how to get them to take horrible tasting decoctions. And that's one of the advantages of using the little treasures, is that they are relatively palatable and easy to take. Before talking about individual diseases, I would like to say a few things about the characteristics of children. And the first one is very important, that the spleen is nearly always deficient. We are born with a weak digestive system, with a weak spleen. Everyone. You can see it in a baby. The whole baby's life revolves around sucking its milk and burping and belching and digesting. But the spleen gets gradually stronger as we grow up, or at least it should get gradually stronger. So as we grow up, the digestive system gets stronger and stronger. By 5 or 6, if all goes well, the digestive system is much stronger. Well, what it does mean that the spleen is often deficient is that when I use a herbal remedy, this is reflected also in the little treasures, I nearly always will have one digestive herb. Whatever the child has, whether he has enuresis or asthma or cough, there would probably be at least one digestive herb. The younger the child, the more important that is. The second characteristic is that the yin is often deficient, and this is entirely different than the yin deficiency of adults. The yin deficiency of adults comes from overwork. The yin deficiency of children can only come from fevers. If a child gets a high fever with an infectious disease, this easily burns the yin, and you can see it on the tongue lacking a coating. The tongue fu are vulnerable in children. They get easily diseased. They are vulnerable to disease. For example, when children get an invasion of wind, it's very, very often it goes to the lungs, and they get phlegm and heat in the lungs. But there is also the other side of it, as we will see in a moment, that the zangfu also recover easily, more easily than in adults. Qi is easily deviated from its pathways, means what? Especially in the digestive system, stomach and spleen. Whatever disease a child has, for example, invasion of wind, the younger the child, the more he'll be prone, for example, to vomiting or diarrhea. So that's because Qi is easily deviated from its pathways. Children can fall ill easily, and the illness can easily become serious, more than in adults. And for example, if a child has meningitis, he could become to a very serious condition within 3 days. And in the beginning stages, it would not be discernible from any normal invasion of wind. And as I said, the other side of the zangfu being vulnerable is that also the zangfu are clear. What does clear mean? It means that children's bodies are usually not encumbered by pathogenic factors as an adults are. For example, let's say an adult of around 50-year-old, every adult of that age will have some Qi stagnation, maybe some dampness, some phlegm, some heat, some blood stasis. It will have something, 1 or 2 or 3 of these pathogenic factors, which encumber the body's physiology and make treatment more difficult. Not so in children, and that's why it's very rewarding to treating children, because they do react well, because the zangfu are clear. The liver is often diseased. This is intended not in the sense as in adults, the liver, the famous liver Qi stagnation, not that. But the liver is often diseased in children in fevers, when the yin is damaged, leading to wind and convulsion. And this is the meaning of the liver is often disease in this context. And children are prone to heat, and this is very, very common. I would say of all these guidelines that I'm giving you, probably the 2 most important ones are this, that children are prone to heat, and that their digestive system is inherently weak. And this is very important to remember. Children are prone to heat, and you can see very frequently that is a child's tongue in this picture. You can see red points everywhere. And when a child has red points everywhere, it usually indicates stomach heat more than anything else. But it is incredibly common. And when a child has an invasion of wind, in my experience, 9 out of 10, it's wind heat rather than wind cold. So in doubt, when treating a child with an invasion of wind, I would say always treat it as wind heat. Of course, children do suffer from cold too, but much more from heat, and that's why red points on the tongue in children are very common. And finally, the Shen is labile, as everyone knows. Everyone who has children will know, which doesn't really have much clinical significance. Children can become very happy and then start crying the next moment and then start laughing. All a behavior that in an adult would be considered mental illness. In children, it is normal. The Shen is, as they say in China, labile. And the Shen also gradually matures. And I would actually say that it becomes mature around the age of 7, roughly. So I want to say a few things about the diagnosis of children, and especially of the tongue diagnosis. The principles of tongue diagnosis in children are the same as adults, but there are some differences. One is that the tongue is usually red, very often red, and has red points. And especially often you see red points everywhere, which may be confusing, because if you see red points everywhere, You may wonder, where is the heat? Usually, if there are red points everywhere, the center of that heat is in the stomach. And another thing we see frequently in children is a geographic tongue, which is a tongue that is lacking a coating in patches, like the bottom right, the one on the bottom right, is geographic, i.e. it has like islands on the tongue that are missing a coating. And by the way, there's an interesting correlation that they've observed in China, that children with geographic tongue like that more common in allergic children, atopic children suffering from atopic disease. The tongue on the top right we've already seen is a very good example of red points, and so is the one on the bottom left. And actually all three of these tongues have got red points. And the top left is even a more severe case. The top left will be a very good example of a yin deficiency tongue in a child from a fever. If you see a tongue like that in an adult, you can bet that person has been overworking for 10 years, 20 years, 30 years, irregular diet, overwork, gradually leading to yin deficiency and NPD. In a child, that's not the case. Most commonly, that will be to fever, burning the yin. And again, we see here examples of many tongues with the red point. So let's talk about acute tonsillitis. Acute tonsillitis is a very good example of toxic heat. And if you look at that picture there of tonsils from the top right, you don't need any other diagnostic element. You don't need the tongue, the pulse, face, symptoms, nothing. Just looking at the tonsils like that, that is toxic heat. Why is it toxic heat? Because toxic heat is a heat which manifests with redness, with swelling, with pain, and pus. So a swollen tonsil like that from an acute infection with pus on it cannot not be, it is toxic heat. The toxic heat is a type of heat, except that there is a specific category of herbs that clear toxic heat, which are used for that type of tonsil. And the remedy throat soothe will be the remedy for this type of invasional wind heat. This would also be an invasional wind heat, but complicated with toxic heat. And if the toxic heat is really very severe, you can add a three-treasure remedy called expel toxic heat, which could be added to this one, to throat soothe. If the tonsillitis becomes chronic, which is very, very common in children to happen, then you can use this remedy called sinus relief, which is for residual pathogenic factor. And residual pathogenic factor is extremely common in children. If we go back to this for a moment, let's say a child has got an invasional wind heat with tonsillitis like this. Maybe he has antibiotics, maybe he appears to recover, goes back to school, but from the Chinese perspective, there is a residual pathogenic factor, a leftover toxic heat, which stays there and predisposes the child to further infection, and most of all to the condition becoming chronic. So throat soothe is for the acute stage, and sinus relief is for the chronic stage of residual pathogenic factor. And that will be a child who is apparently well, but His tonsils are always a little bit swollen, he always has a little bit of sore throat, and he has frequent acute attacks of wind with tonsillitis. And as I said, I'll give you other examples of residual pathogenic factors in children. Incredibly common. I would say probably 50% at least of children's problems we see are residual pathogenic factors left over from infections and invasions of wind. And this is Summer Relief. I've sent everyone a handout yesterday and today. If you have not received it, send me an email and I'll send it. So you have all these slides in your handout. These are slides which describe in more detail the remedy, Summer Relief. And this is a slide that gives a tongue related to that remedy, the classical antecedent, and how the remedy differed from the classical antecedent. And this is a very good example, another very good example of red points. Notice how the red points are all over the front and also the sides. By the way, these red points here in the front are not heart related. These are lung related. So there is heat in the lungs. And these are stomach and spleen related. So there is heat in stomach, spleen, and lungs. And let's talk about a chronic otitis. Again, I'm only concentrating on the chronic part of it because that's what we very frequently see. We'll see a child who has repeated ear infection. And the most common cause of that, as you can see from this arrow here, is again a residual pathogenic factor. The child had an invasion of wind, maybe was treated with an antibiotic, he appears to recover, but there is a leftover pathogenic factor, which in the case of the ear will be damp heat. So the most common situation will be that there is damp heat in the ear, which will be Shaoyang area, against the background of stomach and spleen deficiency. Incredibly common situation. And that is what this remedy is for. The remedy ear relief is for chronic conditions of recurrent ear infections against the background of stomach and spleen deficiency. Incredibly common. So ear relief treats primarily the residual pathogenic factor. If the spleen deficiency is pronounced, you can combine it with little sentinel. Little sentinel is a stomach and spleen tonic for children. By the way, when I use two remedies, I prefer to use them at different time of day. For example, in this case, I might use little sentinel in the morning and ear release in the afternoon rather than half and half. I prefer that way, and I think it works better that way. And again, here you've got two slides which describe the remedy more in detail. Accumulation disorder or abdominal pain is also incredibly common in children. In Western medicine too, it's a very common problem, and in Western medicine actually is also very kind of, very often there is no explanation for this. Accumulation disorder is usually the name given to younger children, to babies, which is equivalent to retention of food. It simply means that the spleen cannot digest the food accumulates, and it is a form of dampness, but it's not called dampness, it's called accumulation disorder in babies, which will cause abdominal pain. Incredibly common. and unfortunately very, very common in the children we see, because many of the children we see do not have a good diet. Starting from the beginning, they may have been weaned too early, or they may not have been breastfed at all. They may have had solid food too early. And later on, and we all know, many children will have too much sugar, too much bread, too much biscuits, cakes, sweets, and things like that. All the things which would definitely lead to what is called accumulation disorder. And accumulation disorder is often in the children we see combined again with the spleen deficiency. And the remedy I have for this condition is tummy soup, which is, as you can see from these ingredients, it partly resolves dampness, partly removes chi. There's only one tonic herb, hydroshen, and there are 3 digestive herbs in this case: Shanja, Lycopodium, and Guya. So the emphasis of this remedy is primarily on the food accumulation rather than tonifying the spleen, although there is one spleen tonic. So again, this remedy could be combined with Little Sentinel if we want to tonify the spleen more. And again, I would use Little Sentinel in the morning and tummy soup in the afternoon. By the way, don't be too worried if you miss something, because you will also get a recording of this lecture. So you already got the handout, and you will also get the recording, so you're not going to miss anything. These 2 tongues here are good examples of swollen tongues, because the tongues would be swollen in food accumulation, which is, as I said, somewhat akin to dampness of phlegm. Let's talk about cough in children, another also very common situation, often as a consequence of an invasion of wind. And as we will see when we talk about asthma, in Western medicine there is a tendency of diagnosing a cough as asthma. There is a kind of dogma that if a child has a cough at night, then it's asthma, then it's treated as asthma. That would not be so from the Chinese point of view. There is 2 categories of disease. Cough and asthma in Chinese medicine are 2 separate categories of disease. And chronic cough after an invasion of wind is incredibly common, again due to a residual pathogenic factor in the lungs. And the residual pathogenic factor is either heat or phlegm or both, phlegm and heat. It is very seldom cold phlegm. 9 out of 10 it is phlegm heat. So it's either phlegm or heat or a combination of phlegm and heat. For an acute cough with an invasion of wind, of course we use a 3 pressure remedy, either expel wind cold or expel wind heat. As I said, in children in doubt, I would always use expel wind heat for an acute cough, which is relatively easy to treat. And for wind heat, you can use either expel wind heat in the 3 pressure or throw 2 in the little pressure. And these next 2 slides explain more in detail the remedy for Su, which is a variation of the very famous Yin Chao San. And I've changed it by adding some more herbs which have actually an antiviral effect. And there are also some more herbs that will treat cough. And there is 2 herbs for toxicity as well. That's why we use those for acute tonsillitis. Now, for our chronic cough, not so much a chronic cough, but a cough that has gone past the exterior stage. A cough that has gone past the beginning stage. So a child has got a cold, an invasion of wind, and the pathogenic factor penetrates in the lungs. So it would go from the way level to the chi level. Incredibly common situation, causing phlegm heat in the lungs. And the formula I use is a very good Chinese formula, which is in this slide. Qing Qi Hua Tang Tang, which I've used a lot over the years. It never fails to help, much better than antibiotics. And it is for phlegm heat in the lungs, we treat the cough, restore the descending of lung qi, and resolve phlegm. And in the little pressures, it's called chest release. The chest release is a variation of Qing Qi Hua Tang Tang, as we've seen in this previous slide, which means clearing qi and resolving phlegm decoction. So that's if a child has more of an acute chest infection. If the phlegm heat in the lungs becomes more chronic, it's not acute, the child doesn't have a fever, but there's a constant cough. Then I might use Wendantang, which you can see in this slide, which in the little pressures is called resolve phlegm. So these two are two very fundamental remedies for phlegm heat in the lungs causing cough. One more of an acute stage, chest release, and the other resolve phlegm more of a chronic stage. As you can see in this slide, the differences from chest release from the Qing Qi Hua Tang Tang, a stronger action in resolving phlegm, and an antibacterial and antiviral action. And the tongue would be red with a sticky yellow coating as the tongue on the left, especially the one on the left. And this is resolved phlegm compared to Wendantang. Briefly, enuresis in children. The pathology of enuresis in children, 9 times out of 10 is a deficiency. The lung, spleen, kidneys, or a combination of these, and basically also characterized by qi sinking, qi descending. Occasionally you may see a child with enuresis with a full condition. And if it's a full condition, very often the one I see most is liver fire. So that would be seen in a more nervous child, a more irritable child, or impatient child, or highly strung child. Then the enuresis might be due to liver fire infusing downwards. But in most cases, it's a deficiency. Lungs, spleen, kidneys, or a combination of these. And very often it is of a constitutional origin. Very often it may be a constitutional kidney deficiency. So the remedy for this is dry sleep, which is for a combination of lung qi deficiency, spleen qi deficiency, and kidney. deficiency. And it is a variation of Bujung Yichitan, as you can see on this slide here. It's a variation of Bujung Yichitan. And Bujung Yichitan is a famous formula from Lidong Yuan that lifts qi, makes qi rise, and by doing that it would help any races, combined with another formula called Suo Chuan 1, which is a kind of an astringent formula. And I've made a change to the two formula by introducing some herb to calm the mind, which would help the enuresis. Because very often at the root of this enuresis there is also an element of fear. The fear affects the kidneys. Some insecurity in the family from some family situation. So let's talk about asthma, which is a very important subject for me, because when I was practicing in England, I saw a lot of children with asthma and eczema. And both acupuncture and herbs work really well. So I feel it's important that we know how to treat it, because it would save a lot of problems for the child and a lot of medication that they're given. The first thing I ask myself when a child comes with asthma is it allergic or non-allergic? Which Chinese books do not actually clarify, and many times even Western books do not actually make that distinction very clear. And for me, it's a very important distinction. They are both common. We can treat both of them, but the pathology of the two is very different. So let's talk about the allergic asthma first, and I think we've got a good slide here that summarizes the characteristics. How do we know it's allergic asthma? From these features here. Very often it's associated with eczema. Classic situation would be a baby who gets eczema when he's 3 months old and has eczema all the first 3 or 4 years of his life, and then he develops asthma when he's 4 or 5 or 6, or vice versa. So there's a very strong association with eczema, which, by the way, Chinese books never mention. Any Chinese book that deals with asthma, I've never seen one that tackles the fact that it's associated with eczema and why is it associated with eczema. Second is asthma is clearly allergic. Pollen, dogs, cats, horses, most of all house dust mice. And the skin tests are positive, which should be done. The characteristic of asthma is also that wheezing is more pronounced than cough. Classic wheezing. There's not a lot of phlegm. There's a familial incident. It occurs in atopic individuals. What does that mean? Atopy is not a disease. It is the tendency to develop a disease, an allergic disease. And atopic individuals have a raised excessive number of IgE, which are the immunoglobulin responsible for the type 1 allergic reaction of asthma and eczema and rhinitis. And atopy is something you're born with, but it is not a disease. So you can be atopic and not have asthma, not have eczema, and not have rhinitis. But those who do have allergic asthma, allergic rhinitis, and eczema are atopic. And lastly, early onset. Usually allergic asthma is there from childhood. Not necessarily. I've seen it a few cases when it starts as a minor, but usually it starts from childhood. And these are the characteristics of non-allergic asthma. which we're going to discuss soon after the allergic one. But as you can see here, they are the opposite of the first. It's not associated with eczema, it's not allergic, skin tests are negative. Notice how cough is more pronounced than wheezing. There is a lot of phlegm, no familial incident. So they're very different diseases. And in my opinion, the pathology from the Chinese point of view is different. And this slide here illustrates the allergic asthma. There is a picture of a small girl, of a young girl, to illustrate the fact that it starts early in life. And in that picture it also shows the allergens. You can see there the pollens, but also foods can be allergens. Eggs and fish and milk especially can be allergens. And by contrast, this is a non-allergic asthma. So let's talk about allergic asthma first. This is only a reduced discussion of allergic asthma. I have a long discussion of it in my book, The Practice of Chinese Medicine. I have my own theory of allergic asthma, and very briefly in my theory, allergic asthma is different than Xiaochuan. If you look at the Chinese terms in this slide, Xiaochuan, every book will say that asthma in Chinese medicine is Xiaochuan. I do not agree. If you look at the symptoms of Xiaochuan, they don't really describe the symptoms of allergic asthma. They don't describe why it is allergic, what does it mean. They don't describe what atopy is, why is it associated with eczema, etc., etc. And most of all Chinese books will say that asthma, Xiaochuan, is due to phlegm obstructing the lungs. My view is different. I believe that allergic asthma is due to wind in the bronchi, not external wind, but wind in the bronchi. Wind causes spasm and contraction. So it contracts the smooth muscles, and it contracts the bronchi, and there is wheezing. So instead of phlegm, I believe there is wind, and that's why I use herbs that expel wind. And the cause, as for the cause of the allergic asthma, either then or allergic asthma, I consider that to be a deficiency of lung and kidney, more than the spleen, especially in small children. So the bend on the one hand is a deficiency of lungs and kidneys, and the xiao, the manifestation, is wind in the bronchi. And in the three treasures, I have two remedies which are specific for that, for the bend of allergic asthma. There are herbal sentinel yang and herbal sentinel yin, which can of course be used for children, and I do use them for children a lot, to treat the bend, to treat the root cause of the asthma. In this slide here, I illustrate the most common allergens, and probably the main one is the one on the top left, the house dust mite. And more specifically, it's actually the feces of the house dust mite. And house dust mites are everywhere. You cannot avoid them. Every armchair you sit in, every bed, every pillow, every mattress, every curtain, every carpet will have house dust mites. There are things you can do to minimize them. There are various vacuum cleaners that claim to get rid of them, etc., but basically you cannot avoid them. But of course, you only react to them if you are atopic, because loads of people are not atopic and they don't react to the house dust mites. So you only react to these allergens if you are atopic. And by the way, cat saliva is also highly allergenic. And I often see pictures of children, with hugging cats, and it's a very bad idea, especially if they are atopic, because Catalan, as I said, is one of the most highly allergenic substances. And once you are allergic, then you start reacting to other things too, which are not these are not strictly allergies, but they are things which would aggravate them. Smoke, petrol fumes, dust, atmospheric pollutants, even perfume, tobacco smoke, and sometimes also a virus can act as an allergen. Say you are atopic, you have allergic rhinitis, you are invaded by a virus, the cold virus. The virus itself also functions or acts as an allergen, and it triggers off your rhinitis. And most important, also foods. Some of these foods can be allergens, and they should really be avoided by children who have atopic, allergic asthma or allergic rhinitis. So this slide here summarizes the congenital allergic asthma from the acquired asthma with the pathology. And I will not discuss it because I'll discuss the treatment more in detail in a moment. So I said the Ben is deficiency of lungs and kidneys. The Piao is wind in the bronchi. The question is, do we treat the Ben or do we treat the Piao or do we treat both? And this is what I do. In a period of time when attacks are frequent, I treat the Piao. And very often I can gauge that also from the use of an inhaler. Most children that come to us will be on some inhaler for asthma. If they use the inhaler every day, for example, then I call that acute. You need to treat the Piao. Say they use the inhaler only once every 10 days or maybe 2 weeks, then I will call that chronic, and you need to treat the Ben and the Piao usually. And I must say, in the majority of cases of children I see, I start off by treating the Piao. The Piao means what? Restoring the descending of lung qi and expelling wind from the chest, from the bronchi. And that's what the remedy Breathe Easy is for. Breathe Easy is a variation of Suzhou Jiangqi Dan, and it is for that. It's to treat the Piao of allergic asthma, restoring the descending of lung qi and expelling wind from the bronchi. And Breathe Easy in the little pressure is equivalent to clear qi in the free pressure. So that's what I do when I treat the Piao. And as I said, in most cases I do start by treating the Piao. I don't start by tonifying them. If the attacks are more infrequent, and you can judge that from the inhaler, let's say they have the inhaler once every 2 weeks, then I treat the Ben, but I do not treat the Ben only. I will treat the Ben and the Piao. And it's very important to do that. And how do I do that? By using both remedies, as you can see in this slide. Herbal sentinel to treat the Ben with clear qi in the free pressure, or in the little pressure I will use little sentinel with Breathe Easy. And as I said, when I use two remedies, I prefer to use them at different times of day. In this example, I will use little sentinel in the morning and Breathe Easy in the afternoon or evening. Now I repeat, it's very important to treat the piao as well as the bend. It would be a mistake to treat only the bend, to tonify only. In fact, there might even be worse if you use only a tonic remedy. When I treat these children, these allergic children, there is also a lot you can do with simply with lifestyle advice. It's very important, as I just said earlier, that you cannot get rid of house dust mites. A world without house dust mites does not exist, but you can reduce their numbers though, and it will help. It does help. And this is what you can do. In the windows, for example, use blinds rather than curtains. Remove the curtains. Floor, remove the carpet. Have a wooden floor. Use anti-allergenic mattress and pillow covers. They are very important. They are covers which let the air go through but not the house dust mites. That's very important to do. And if the child has a favorite soft toy like that one in this picture here, it should be put in the freezer for overnight, once a week. So that kills the house dust mite. So it does help to take all these measures to reduce the number of house dust mites. By the way, there was a doctor in England about 200 years ago, long before they knew anything about allergy. And he said that people with asthma improve by removing curtains and carpets. He said that 200 years ago. And this slide again compares allergic versus non-allergic asthma with the remedies, which I've already mentioned for acute and chronic. So let's now talk about the non-allergic asthma. By the way, going back to allergic asthma just briefly, acupuncture is also great. Very, very helpful. So if a child came to me with asthma, I would give him these remedies, but also acupuncture. It's very effective acupuncture in making lung qi descend and opening up the chest, opening the lungs, and making lung qi descend. Very simple. In the child, it will be very, very simple. Lung 7, lung 1, and bladder 13, and lung 5. I would say these 4 points would be the 4 major points. Lung 7, lung 5, lung 1, and bladder 13. And the two together with acupuncture and herbs, you do get very good results, and they come off the medication. It's very, very satisfying that you treating a child because you prevent morbidity for many, many years to come. So these are the characteristics of non-allergic asthma, which we have already seen. And it is also common. And in most cases, it is a residual pathogenic factor. And contrary to what I said earlier, non-allergic asthma does correspond to Xiaojuan. It does. And it is due to phlegm. So contrary to what I said for allergic asthma. The piao is phlegm obstructing the lungs in the form of residual pathogenic factor. The pen is usually spleen deficiency, skin and lung deficiency. And it does correspond to the Chinese disease of Xiaojuan. Incredibly common in children. And in the form of residual pathogenic factor from repeated invasions of wind, especially when they are treated with antibiotics. Unfortunately, many children who have this problem, the non-allergic asthma, which is simply due to phlegm obstructing the lungs, unfortunately are given inhalers. They are treated as if they had allergic asthma, and they are given inhalers, bronchodilators and steroid inhalers, which is not really treating the cause, because the inhalers are not going to resolve phlegm from the lungs. So it's very, very sad when this happens. And in children, the younger the child, the more the non-allergic asthma may be aggravated by the accumulation disorder that we mentioned earlier. So the accumulation of food would aggravate the residual pathogenic factor and non-allergic asthma. So I repeat, in the non-allergic asthma, the Ben is the biggest usual lung disease, and the Piao is phlegm in the lungs, obstructing the lungs, preventing lung qi from descending, which may or may not be aggravated by accumulation of food. What I do with this child? In the acute stage, I treat usually Piao, and in the chronic stage, treat both Ben and Piao. So as you've noticed, in both allergic asthma and non-allergic asthma, I never treat only Ben. I never tonify only. So either I treat the Piao only, or I treat both Piao and Ben. And I think that's very, very important. And as I said earlier, if you tonify someone with phlegm in the lungs, you tonify only, they may even be worse with herbal medicine. And so in the acute period, I use Breathe Easy plus resolve phlegm. Why both? Because Breathe Easy will stimulate the descending of lung qi, and resolve phlegm will resolve phlegm from the lungs. In the chronic period, I use 3 remedies: Breathe Easy, resolve phlegm, and little fentanyl. Again, when I use 2 or 3 remedies, I use them at different times of day. Okay, so let's see, we've got some more time. This is time to talk about skin diseases or eczema. Since we have discussed allergic asthma, many of these children also have eczema, and actually in England I saw a huge number of children with eczema. And children or teenagers or adults for that matter. And especially in children, it makes their life a misery, a total misery. It's a dreadful disease. So it's very important to be able to treat it. And again, herbal medicine is very good for that. Acupuncture is also good for that. And I use very frequently this Chinese formula, Chu She Wei Lin Tang, variations of that formula. And that's why I've chosen that formula for clear radiance. So clear radiance can be used for atopic eczema. And this remedy resolves dampness, but also expels wind and clears heat. And there is a couple of herbs that to calm the mind. Why calm the mind? Because calming the mind will help to stop itching. Because actually the major problem in atopic eczema is actually the itching and the scratching. Some of the skin manifestations, the swelling of the skin and the redness, the excoriation of the skin, is not due to the disease, but is due to the scratching. So it is of major importance to actually stop itching. And you stop itching partly by clearing heat, partly by expelling wind. And by the way, acupuncture is also good to stop itching. And with acupuncture, you stop itching by treating the heart. Heart 7, for example, will help to stop itching. So that's very important to do. So this is compares this remedy to its classical antecedent. I've only got one tonic in the whole remedy for the bend of allergic asthma, so that it treats atopic eczema, which, as I said, is very distressing disease and difficult to treat, not easy, because it's congenital and is due to atopic constitution. It's not like any skin rash. It's not like a normal skin rash for wind heat or blood heat or damp heat, etc. It's a more constitutional problem due to the atopic constitution. Little Sentinel is a tonic remedy. Very simple tonic of qi and blood, a variation of Bajjan Tang, the famous Bajjan Tang. And it tonifies lungs, spleen, and kidneys. So I've mentioned Little Sentinel a few times in connection with treating the bend, either allergic or non-allergic asthma, treating the bend. Or Little Sentinel can also simply be used in a child of a weak constitution with a weak spleen, provided there is no residual pathogenic factor. If there is phlegm, food accumulation, then that must be treated before you try. And the only difference from the original remedy, from the original prescription, is that Little Sentinel also tonifies the kidneys. Why I put tonifying the kidneys there? To treat the bend of people with an atopic constitution. And losing mind is the remedy for ADD, attention deficit disorder, or ADHD, attention deficit hyperactivity disorder, which is probably a new disease. I say probably because we don't know whether people had ADD in ancient China. They might have had, we don't know. But it's certainly a disease that is very much very common nowadays. And I have my theory about ADD is that it's due to three aspects of the psyche: the Shen, the Hun, and the Yi. The Shen of the heart, the Hun of the liver, and the Yi of the spleen. And the easiest way to discuss it is to look at the diagram, this diagram here. Notice that some of those lines are thick and some are thin. So the Shen obviously is involved always. The Shen is cognition, thinking, memory, the Shen of the heart, cognition, thinking, memory. So the Shen must be involved in every case of ADD or ADHD. And you look at the thick lines from the Yi and the Hun. So in ADD, the Yi is more involved. The Yi of the spleen is responsible for memory, concentration. The students can't concentrate, they can't sit still. So that's the pathology of the Yi. Or if they have hyperactivity, it would be a pathology of the Hun. Because the Hun gives movement to the Shen. And when the movement is excessive, then the person could be slightly manic or, in children, hyperactive. Interestingly, the Hun is also responsible for artistic inspiration, and these children are often artistic. So I think this diagram is probably the best way of explaining the pathology related to all three of them in different degrees. The Shen in both cases, ADD and ADHD, the Yi more for ADD, and the Hun more for the hyperactivity side of it, ADHD. And this diagram also explains the various pathologies. Some of it may be deficiency, and some of it may be due to phlegm, or maybe fullness. Some may have heat, heart heat, or heart fatigue. And the remedy I've chosen, the prescription I've chosen, is a variation of Quenzaurentan. Quenzaurentan, which is a formula that nourishes the liver yin and calms the Shen and the Hun. But I've changed it, 25 heart blood, which is 25 the Shen, and also subduing liver yang for the hyperactivity side of it. And I think this is probably the last one. Silent night is for small babies, small children that cry a lot at night. Crying at night, by the way, could be due to various things. It could be due to stomach heat, that's very common. Especially a sign of crying at night from stomach heat in children very often is sweating on the forehead. Especially little children, like 2 years old or 3 years old. The crying at night sweating on the forehead is often due to stomach heat. Of course, it can be due to the heart, the Shen, the heart heat. It can be due to fright. And crying at night can even be due to a prenatal shock, prenatal fright. Dr. Shen used to talk about that, and he used to say that these children with prenatal shock often have a kind of a bluish tinge on the forehead. And silent night is also a variation of Quenzaurentan, and with a stronger action in nourishing yin and stronger action in clearing heat, liver and heart heat, because, as I already said, children are very prone to heat. And I think this brings us to the end of the webinar. As I said, if you have not received the handout, let me know and I'll send it. And also you will receive a recording of it, so you don't miss anything, but wait a few days before you get the recording. So thank you very much for attending, and for especially in July, in the middle of the holiday time. And I hope it was useful, and I hope to see you again sometime maybe in the autumn. Let me know if there is any subject you're particularly interested in. Give me your ideas or your feedback. I'll be interested to hear. Thank you very much, and goodbye.